the California Department of Public Health brings you One Health in Action.
Our community is not just comprised of humans. They have pets in there. We have waterways. We have natural resources. We have farms. So we need to have a holistic approach to address these pressing One Health topics.
One Health is a globally recognized approach that incorporates the interdependency of people and animals and our shared environment into strategies that achieve optimal health for all.
These are approaches that are not really new. Some of this goes back to Aristotle and even before that. Indigenous communities in California, for example, in their traditional wisdom, they understand the importance of environmental and animal and human interactions for health.
And when we have this bigger picture understanding, we can start to recognize the influences and impacts that help us prevent the issues that we're working to solve. Some of these One Health challenges that impact us in California are zoonotic diseases, such as avian influenza or COVID-19. This also includes vector-borne diseases spread by mosquitoes or ticks. Impacts of climate can lead to extreme heat and disasters, such as wildfires and floods. Toxic chemicals like pesticides or forever chemicals threatening the entire ecosystem. Antimicrobial resistance and the medications we use to treat both people and animals. Water contamination from pathogens, pollutants, or harmful algal blooms. The protection of our food safety, whether it's produce, animal-based proteins, or processed foods, and so many more examples that a lot of us are addressing in our work every day, but often from different perspectives.
We see that in order for this work to be done well, it requires the state and local partnership to happen intentionally, constantly, and consistently.
We all make better decisions that can improve our community health when we're talking with experts in multiple areas and taking those perspectives into account as we're making decisions.
One of the really cool One Health projects we've been working on is the Greater Sierra Sacramento One Health Regional Collaboration, where we host quarterly convenings of leaders from different intersecting disciplines to talk about locally relevant One Health topics. In our most recent convening, we actually worked through a tabletop exercise based on an outbreak scenario involving a pathogen that could infect people and pets through spreading through rodents or water in the environment. And that gave each agency a chance to share what their role would be in coordinating a response. So the Agricultural Commissioner, for example, discussed their role in preventing contaminated food, or the Vector Control and Wildlife Agency strategized on how to trap rodents and get them for testing. And the environmental health and water quality experts explained sampling and testing of representative water samples. We also had animal control officers and veterinarians teaching the group about this disease in dogs. So this exercise was a great way to demonstrate and train partners on how to implement the One Health approach. And having that diverse expertise in one room really helped everyone understand the overarching impacts of disease outbreaks and the rules and resources that each agency has. It also gave participants a chance to really build those critical interagency relationships, which will be so valuable for more effective coordination if they have to respond to an outbreak in the future.
Really an opportunity for all of us to learn, combining, getting different disciplines together, us learning alongside each other, training and thinking about these problems from different perspectives is really helpful.
Taking a One Health approach, really pulling in the agricultural interests along with the environmental health and human health interests are really important in taking a coordinated approach to addressing the needs of our community.
It's the commitment that when we're going to address a problem that we ensure that the right stakeholders are in the same place, sharing their concerns, providing their subject matter expertise, and hopefully coming to consensus on what actions we can take together, whatever the issue might be.
Having that opportunity to come together and have that conversation and problem solve together, it's such a great opportunity to really broaden our view of how we actually tackle the complex public health challenges that we are constantly seeing emerge over time.
To learn more, visit our CDPH One Health webpage at go.cdph.ca.gov/onehealth.